Hello, it's a great pleasure to have you here. My name is Fabio Ronchi, and I have been practicing Shiatsu and bio-natural disciplines for about 20 years. I have attended numerous courses in Italy and abroad with some of the best masters in the field, who taught me how to practice. With this course, I have decided to teach you an easy acupressure sequence for neck stiffness and cervical pain in 20 steps. With what you learn, you will be able to help your friends and family reduce their pain and improve their well-being, and you will see, they will be grateful. You will need to apply yourself a little, but the demonstration videos and the PDF file with all the steps explained in detail will help you. It's about doing some practice. An online course cannot replace a live course, and if you become passionate about these techniques, I suggest you attend an accredited school. I'm sure there are many reputable schools in your country or abroad, whether for Shiatsu or acupressure. Acupressure is an ancient technique that comes from the East and has thousands of years of history. In the West, it gained popularity in the 20th century, alongside interest in alternative therapies. In recent years, scientific studies have confirmed its benefits, such as relief from pain and stress. Today, it is practiced worldwide, both as a method of self-pain management and in integrated therapies, and it is highly valued for stress management and muscle pain relief. The techniques I present in this course are derived from Japanese Shiatsu. Shiatsu indeed means finger pressure and is the term used when referring to acupressure in Japan. An important aspect of our study will be self-treatment. This allows us to become aware of the effects of our pressures on ourselves while also giving us the opportunity to address any issues we may have. There will be a lesson covering all the self-treatment for the neck. The course is essentially practical. We will begin by learning to perform the pressure technique using our thumbs. Then we will move on to studying the sequence with the recipient lying on their side. There will be a lesson where I explain the various steps in detail. After that, we will put everything together in a complete sequence on the side, both left and right. In the next section, we will do the same for the position lying on the stomach or prone position. Before the concluding section, you will find a lesson with the entire sequence performed without interruptions and without commentary, but only with captions. In the resources for this lesson, you will find a PDF file with all 20 steps of the sequence described precisely, along with screenshots from the videos. This way, you will also have a visual reference. Well, I think I have covered everything. Happy studying and, above all, happy practice. Neck stiffness and cervical pain are extremely common issues that affect many people, regardless of age or lifestyle. These problems can arise for various reasons, including prolonged incorrect postures during work, driving, or even while using a mobile phone. Stress and muscle tension resulting from hectic lifestyles or episodes of anxiety can significantly contribute to these disturbances, exacerbating the situation. Neck stiffness is one of the main symptoms, often accompanied by localized pain that can range from mild to very intense. This pain can make it difficult to rotate the head or tilt the neck, interfering with daily activities and causing discomfort. In some cases, cervical pain may radiate to the shoulders and even lead to headaches originating from tension in the neck muscles. Moreover, neck stiffness can result from physical trauma, such as in car accidents, where whiplash can overload the muscles and ligaments of the neck. Intense physical activities or sudden movements can also lead to muscle strains or tensions. It is important to note that posture plays a crucial role in cervical health. Extended use of electronic devices, such as smartphones and computers, often leads to positions where the head is tilted forward. Over time, this can result in muscle imbalances and pain. When experiencing neck stiffness, it is essential to listen to your body and adopt preventive measures to avoid worsening the condition. Regularly practicing stretching and strengthening exercises for the neck muscles can be beneficial. Additionally, maintaining good posture and taking frequent breaks during sedentary work periods is important. It is crucial to emphasize that acupressure should not be used in certain circumstances. The information you will learn in this course is not intended to replace the advice and intervention of a qualified medical professional. While acupressure can offer significant benefits for some conditions, there are specific situations where it is essential to avoid applying these techniques. In particular, you should never perform acupressure on the neck in cases of whiplash, which may occur due to car accidents or similar traumas. This condition can involve injuries to the muscles, ligaments, and vertebrae in the cervical region, and improper treatment could further aggravate the situation. Additionally, avoid any manipulation if the person you want to help has acute and persistent pain in the cervical area. This may indicate a more serious problem requiring immediate medical evaluation. Other warning signs include neurological symptoms such as numbness, tingling, or weakness in the arms or legs, which warrant thorough assessment by a doctor. You should also exercise caution in the presence of a diagnosis of cervical hernias or circulation problems. Conditions such as aneurysms, plaques, or arteriosclerosis can increase the risk of significant complications. This is particularly true in the anterior cervical area if these conditions are subjected to manipulation. In all these circumstances, caution is of utmost importance. A healthcare professional is required for a correct diagnosis and to receive the most appropriate treatment. Your health and that of your loved ones should always take priority. In conclusion, the acupressure techniques I will teach you cannot replace the intervention of a healthcare professional or an expert practitioner. Acupressure can be used for mild issues, tension, fatigue, and stress in the cervical area. For example, when you sleep in an awkward position and wake up with discomfort, it is essential to apply the techniques with caution and attention, respecting the tissues, especially the first time you perform them. Acupressure is a technique that, as the name itself suggests, is based on pressure applied with the fingers, particularly with the thumbs. The way you apply pressure is fundamental to achieving results. This aspect is essential in practice. Correct pressures allow for rebalancing fascia and muscles, relieving contractures, alleviating tensions, stimulating blood and lymphatic circulation, and improving the overall well-being. In treating the cervical area, primarily overlapping or adjacent thumbs are used to apply pressure on specific points or lines of points. In some parts of the sequence, palms of the hands and single thumbs are also used. The application of pressure does not rely on muscle strength but employs body weight. This ensures consistent perpendicular pressure. The pressure is active, rhythmic, fluid, soft, and respectful of the tissues. It has an entry time, a holding time, and an exit time. The 3 times of entry, maintenance, and exit have approximately the same duration. The duration of pressure ranges from 3 to 5 seconds. Normally, the pressure time is divided into 3 equal parts. If we consider a standard pressure of 3 seconds, it will take 1 second to enter the point, 1 second of pause to feel the consistency of the tissues, and 1 second to exit the point. The pressure enters perpendicularly and exits the same way. It is important that the tissues do not slip under the fingertip. It has a wave pattern that makes it very dynamic and versatile for toning or dispersing according to the needs and conditions of the tissues, modulating the rhythm. A general rule is to stay between pleasure and pain. You feel the pressure and notice a bit of pain, but this is liberating and somewhat pleasant. Gradual entry and exit are fundamental. Entering softly allows you to sense the responses of the structure and myofascial layers under the skin. At a certain degree of pressure, the tissues do not yield and resist. We need to stop the pressure at this intensity without going beyond. The ability to dose pressure according to the recipient's needs is acquired through practice. It takes time. Initially, it is better to use light pressures and try to perceive what happens in the tissues under the thumbs. In our sequence, we will almost exclusively use pressure with the thumbs. The pressure is perpendicular to the tissues and is applied with the fingertip, tilting the body so that the fingertip, forearm, and the rest of the body are aligned. Wrists, elbows, and shoulders are soft, arms are often extended but not stiff, allowing for the transmission of body weight. The pressure starts from the middle of the operator's body. You use your entire body when pressing, from the feet to the abdomen, and then the hands and fingers. The shoulders are relaxed, and the abdomen is slightly contracted as it approaches the pressure point when pressure is applied. However, it is essential that the thumb is positioned correctly. It should support the weight of the first phalanx, and the metacarpal bone should slightly extend beyond the pressure line. Basically, this bone should slightly extend when pressure is applied. Here you see it exactly. This adjustment helps preserve the physical integrity of the thumb and is very important. If this is not applied, you may encounter problems such as tendinitis and various pains. It is not possible to practice if the thumbs and wrists are inflamed and painful. Now, let's try the pressures using a cushion. Well, let's start with thumb-on-thumb pressure. Place the right thumb underneath and the left thumb on top. With the remaining fingers, grasp beneath the cushion, as if giving ground. When pressing with the thumbs, the other fingers play a crucial role in grasping the surface of the body and providing ground. This creates complete contact involving both hands. Let's try pressure for 3 seconds. Count 1 to enter, 1 for a pause, and 1 to exit. We will perform a line of 6 points. Okay, let's start. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. Okay, let's repeat it. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. Okay, once again. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. We can also try a longer pressure of 5 seconds, repeating it 3 times. The same way, thumb on thumb. 1, 2, 3, 4, 5, 2, 2, 3, 4, 5, 3, 2, 3, 4, 5. As you can see, the times for entering and exiting the point are equal. Now let's switch the thumbs and repeat the same line of 6 points. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. Okay, let's repeat it. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. Okay, once again. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. Let's repeat the 5-second pressure for 3 times. 1, 2, 3, 4, 5, 2, 2, 3, 4, 5, 3, 2, 3, 4, 5. Now let's try pressure with the thumbs side by side. Pressure applied with one thumb next to the other has a less strong effect compared to when overlapping thumbs are used. Place the 2 thumbs next to each other, touching at the tip or slightly apart. Let's do a line of 6 points with the thumbs side by side. Okay, let's go. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3, 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3, 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. Now let's apply pressure using just one thumb. This method of pressing with just one thumb is suitable for delicate points on the body or very small areas. Okay, let's start. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3, 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3, 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3, 6, 2, 3. When performing acupressure, it's essential to adopt positions that ensure the techniques are effective. This helps prevent straining or inflaming your thumbs and wrists. There are 3 key positions relative to the receiver. In the basic posture, position yourself at a 45-degree angle to the receiver. Keep both knees close together, with your lower legs, if possible, resting on the edge of the treatment table. With the receiver on your right, rest the inner thigh of your left leg and the outer thigh of your right leg on the table. When applying pressure, move diagonally relative to the receiver's center line, trying to maintain contact with the table using your thighs. This posture focuses support on the inner thighs, ensuring good pressure and stability, which improves the treatment's effectiveness. It's crucial to keep your spine elongated while working. To achieve this, keep your thighs firmly against the table and your gaze forward. Otherwise, you risk bending your cervical spine, which can lead to back tension. In the second posture, position yourself perpendicular to the side of the table, resting your thighs on it when possible. When applying pressure, your movement should be straightforward at a 90-degree angle to the receiver. Your hips and shoulders should be parallel to the table, with your knees slightly bent to avoid straining your back. Avoid leaning your head forward to prevent neck tension. The posture must be grounded, maintaining tension from your abdomen to your feet while keeping your upper body relaxed. Another position is for treating the suprascapular point with the receiver lying on their side. This is a variation of the previous position. You stand at the head of the table with one leg forward. Your arms are extended, and all weight is supported by the overlapping thumbs. Additionally, there's a position for treating the suprascapular point with the receiver in a prone position. You stand at a 45-degree angle toward the working side and lean slightly forward. Extend your arm in line with the point and use your body weight to apply pressure. Regarding the massage table, I recommend a foldable wooden table that is well padded, ideally with memory foam material. You can find great prices online. The width should be no less than 70 centimeters and long enough for taller clients. It's also important that it comes with a face cradle cushion for prone treatments, especially if the person cannot turn their neck. Now, let's discuss the proper height for the massage table. Generally, I recommend setting the table height 10 to 15 centimeters above your knee. This allows you to extend your arm when resting your hand on the receiver's body. Your shoulders should remain relaxed. This lesson serves as an introduction to the upcoming sections where I will teach you the 20 steps of the sequence for neck acupressure. The treatment begins by having your recipient lie on their side in a comfortable position. The sequence begins with treatment in a side-lying position, allowing for deep neck treatment. You normally start working on the recipient's left side, while they lie on their right side. If the left side has more issues, pain, or tension, begin on the right side. The recipient lies on their right side, with their right leg extended and head resting on a pillow. The right arm is extended on the table, perpendicular to the torso, while the left arm is along the side. For better trunk stability, the recipient crosses the left leg over the right leg. The left knee and the inner side of the left calf rest on the table. The torso should form an angle of about 60 degrees with the table. The pelvis and shoulders must have the same angle relative to the massage table. The recipient's back should be at the edge of the table, with their head on a high pillow. The recipient should be near you with their back. Use a moderate and constant pace, as if you were doing Tai Chi. Stay soft and relaxed. Adjust the table so that it is 10 to 15 centimeters above your knee. Use positions where you do not strain. Position your thumbs as I taught you in the pressure section, and follow my instructions. Do not improvise. After finishing the treatment on the left side, the recipient should lie on their left side. You need to repeat all the techniques on the right side, switching your positions and those of your thumbs as needed. Later, the recipient should lie face down in prone position. They will keep their arms slightly bent at the side of their head. You can use a pillow under their feet to avoid tension on the ankles or the tops of the feet. Some techniques are demonstrated with the recipient turning their head left and right. If they cannot rotate their head, use the donut pillow provided with the table to keep their head straight. Now comes the fun part. It's time to start studying the acupressure sequence. Wish you good study. Anterior cervical region. 4 points are addressed, equally spaced along the medial border of the sternocleidomastoid muscle, from the carotid sinus to the origin of the sternal head of the same muscle. Point 2 is acupuncture point stomach 9. The pressure should be light and directed towards the back of the neck. I position myself behind the recipient at the level of their chest. With my left hand, I support my body by resting it on the table in front of the recipient's chest. I apply gentle pressure with my right thumb on the 4 points of the anterior cervical area, pinching with the remaining fingers that wrap around the lateral cervical region. I perform pressures lasting 3 seconds each and repeat the maneuver 3 times. Lateral cervical region. 4 points are addressed, equally spaced along a line, from the area below the lower border of the mastoid process to the transverse processes of C6 and C7. The pressure is applied to the insertions of the scalene muscles, the elevator of the scapula, and the transverse processes of the cervical vertebrae. Starting from the same position, I treat the first point in the left lateral cervical region, just below the mastoid process. I apply vertical pressure with my thumbs placed one on top of the other, perpendicular to the recipient's surface. The left thumb is above the right. Each technique lasts for 3 seconds. I proceed to the other 3 points, descending along the neck to the base of the shoulder and the suprascapular region. The pressure is intense but should always be adapted to the recipient's condition. I repeat the treatment 3 times. Medulla oblongata. 1 point is treated at the center of the nuchal fossa, corresponding to acupuncture point governor vessel 15. The pressure involves the origin of the trapezius, the nuchal ligament, the suboccipital muscles, and other local structures. I slightly rotate the recipient's head to the right. The medulla is located at the center of the nuchal fossa, just below the external occipital protuberance. I gently support the recipient's head with the palm of my left hand, positioning my right thumb facing upwards on the medulla, and using my other 4 fingers to support the right cervical region. I apply pressure to this single point for 5 seconds, directing it toward the recipient's eyebrows. I repeat this maneuver 3 times. Posterior cervical region. 4 points are addressed, evenly spaced along a line from gallbladder 20 to the base of the neck. The starting point, gallbladder 20, is located halfway between point 1 of the left lateral cervical region and the point on the medulla. The pressure is directed towards the trapezius and the underlying muscles, including the splenius capitis and elevator of the scapula. Without changing position, I place the thumb of my right hand on the first point of the left posterior cervical region, gallbladder 20, which is to the left of the medulla. I overlay my left thumb on my right thumb and apply pressure for 3 seconds. The pressure should be directed towards the opposite side of the recipient, towards the center of their face. Then, I move down to the base of the neck, applying pressure on points 2, 3, and 4. I repeat this maneuver 3 times. Suprascapular point. 1 point is treated located below point 4 of the left lateral cervical region, on the anterior border of the trapezius muscle. The pressure is directed towards the elevator of the scapula. I slightly rotate the person's head to the left and bend their left upper limb so that their hand rests on the table. I then position myself at the head of the table, with my left foot forward. Extending my arms fully, I support the recipient's shoulder with the 4 fingers of each hand. With my right thumb on top of the left, I apply pressure to the suprascapular point. I keep my left thumb underneath to prevent the pinky of my right hand from touching the recipient's face. The pressure is directed towards the center of the trunk, at the level of the spinous process of the 7th thoracic vertebrae, and lasts for 5 seconds. I repeat this maneuver 3 times. Interscapular region. 5 points are addressed, evenly spaced along a line parallel to the spinal column, extending laterally from the spinous process of T1 to the inferior angle of the scapula. The pressure is directed toward the trapezius and the underlying muscles, the minor and major rhomboids, spinal erectors, and others. I position myself at the level of the recipient's scapulas, with my right thumb underneath and my left thumb on top. I apply pressure to each point for 3 seconds and repeat the maneuver 3 times. The fingers of my right hand hold the upper part of the recipient's left scapula, opposing the pressure of my thumbs. As I press, I gradually extend my right elbow, which is slightly bent at point 1. I shift my weight onto my thumbs and avoid applying pressure directly on the scapulas or the vertebrae. I repeat this maneuver 3 times. Repeat the sequence on the right side. Comfortably seated in a chair, let's take a moment to relax. You should aim to adopt a comfortable, relaxed posture, with your shoulders relaxed and your back straight, chest out. Feel the support on the ischial area, ensuring that the glutes are well supported on the chair. The feet should rest firmly on the ground. The first focus is on an anterior line of the neck that follows the edge of the sternocleidomastoid muscle, which runs from the lower jaw to the sternum. This line is created with 4 points, repeated 3 times. It's important to note that each pressure lasts about 3 seconds and consists of 3 phases: an entry, a pause, and an exit. It is essential that the entry and exit phases take the same amount of time. This line should be pressed inward, towards the back, with a gentle pressure, as there are important points and structures related to the circulatory system in this area. Additionally, we need to be cautious of the thyroid and avoid pressing on the trachea, working instead along the edge of the muscle. Okay, let's begin. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3.
The last one.
1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3. The pressure should not be painful and should not press on the trachea, but it should be applied along the edge of the sternocleidomastoid muscle. The same technique is then performed on the opposite side, so we are now on the right. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3.
The last one.
1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3. Once the 2 anterior lines of the sternocleidomastoid have been completed, we will work laterally along a line that runs from the mastoid process to the anterior edge of the trapezius. On this line as well, we will use 4 points. This line involves several muscular structures, including the scalene muscles, the levator scapulae, and, to some extent, the sternocleidomastoid. The pressure is applied using the fingertips of 3 fingers in this manner, simultaneously on the right and left. Starting from below the mastoid process, which is the bony prominence just behind the ear, we can feel that it is a prominent bony area. Okay, let's begin. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3. Second time. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3.
The last one.
1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3. Once this procedure is completed, we will address a very important point located just below the skull at the back, specifically under the occipital region in the central area. This point is also known as the medulla oblongata point. The pressure is applied using two middle fingers placed side by side in this manner, and it is performed 3 times. 3 pressures of 5 seconds each are applied, directed slightly upward and toward the center between the eyebrows or just above the eyebrows, which is known as the glabella. Okay, let's start. 1, 2, 3, 4, 5. 2, 2, 3, 4, 5. 3, 2, 3, 4, 5. Once this operation is completed, we apply pressure along the last 2 lines, which are beside the cervical segment on the paravertebral muscles. This line particularly relates to the splenius muscles of the head. The same technique is used with the fingertips as used for treating the sequence of points along the lateral line. In this case as well, we perform 4 pressures for each line. We repeat the pressures 3 times. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3. When working on the 3rd line, it is possible to add a rotational movement of the head to enhance its effectiveness. Particular attention can be given to painful and tight areas, resulting in a much more intense effect. Once the treatment of the points along the 3 lines on the right and left is concluded, specifically the line of the sternocleidomastoid, the lateral line with the scalene muscles, the central point and the posterior line of the splenius muscle, we can work on a particular point located on the anterior edge of the trapezius. This point is called suprascapular and has a strong effect if a technique of acupressure is applied to it. If we extend the 2nd line we have treated and move from the neck to the front of the trapezius, we encounter a rather painful point. This point is located about 2 fingers from the base of the neck on the inner edge of the trapezius. This is a very important point where the brachial plexus is located. It has a significant impact on cervical issues. We treat this point in the same way as we did for the point on the medulla oblongata. We acupressure 3 times for 5 seconds each. We always use 3 fingers in this manner, keeping the hand in this position. Using the tips of the fingers, we apply pressure. It is important to emphasize that the pressure should be directed toward the center of the body, at the level of the 7th thoracic vertebra, meaning between the shoulder blades. The pressure is quite diagonal and should be painful. We need to seek out the point where the pressure is most painful. So let's start. 1, 2, 3, 4, 5. 2, 2, 3, 4, 5. 3, 2, 3, 4, 5. Then we treat the opposite side. 1, 2, 3, 4, 5. 2, 2, 3, 4, 5. 3, 2, 3, 4, 5. Occipital region. 3 points are treated, evenly spaced along the midline from the meeting point of the two sutures to the external occipital protuberance. The recipient lies face down, with their face and head aligned with the spine. I position myself to their left, with my left leg forward and my hip resting against the treatment table. I use my thumbs together to apply pressure on the 3 points along the midline of the occipital region, from top to bottom. I press on each point for 3 seconds, repeating the entire process 3 times. Medulla oblongata. A point is addressed at the center of the nuchal fossa, corresponding to the acupuncture point governor vessel 15. The pressure affects the origin of the trapezius muscle, the nuchal ligament, the suboccipital muscles, and other local structures. I place the 4 fingers of each hand on the sides of the recipient's neck for support. Then, I apply pressure for 5 seconds on the central point of the nuchal fossa, directing it towards the center of the eyebrows. My thumbs are overlapped, with the right thumb underneath the left. I repeat the pressure 3 times. Posterior cervical region. 2 rows of 3 points are addressed on the left and right sides, evenly spaced along 2 lines that extend from gallbladder 20 to the base of the neck. The pressure is directed towards the trapezius and the underlying muscles, including the splenius capitis and levator scapulae. Remaining in the same position, I apply pressure with my thumb and the other fingers on the points on both sides of the posterior cervical region. I treat both sides simultaneously. My left hand supports the top of the head. Pinching with my right hand, I press for 3 seconds on 2 points at a time, directing the pressure towards the center of the recipient's face. I repeat the maneuver 3 times. Suprascapular point. A point is addressed located beneath point 4 of the lateral cervical region, on the anterior edge of the trapezius muscle. The pressure is directed towards the levator scapulae. The recipient turns their head to the left, and I remove the pillow. I position myself at the head of the treatment table, facing the recipient's head, and rotate 45 degrees to the right, keeping my feet parallel and bending slightly. With my left arm extended, I apply pressure with my left thumb on the left suprascapular point. I direct the pressure towards the center of the trunk, at the level of the spinous process of the 7th thoracic vertebra, as when the recipient was lying on their side. I apply the pressure for 5 seconds and repeat the maneuver 3 times. Interscapular region. 5 points are addressed, evenly spaced along a line parallel to the spine, extending from laterally to the spinous process of T1 to the inferior angle of the scapula. The pressure is directed towards the trapezius and the underlying muscles, the minor and major rhomboids, the spinal erectors, and others. I position myself in front of the long side of the treatment table on the left side of the recipient, at the level of their torso. With my right thumb underneath and my left thumb on top, I press on the 5 points in the interscapular region, moving downward along the spine. With my arms extended and shoulders relaxed, I use my body weight to apply pressure through my thumbs. I avoid pressing directly on the scapula and vertebrae, focusing instead on the spinal erector muscles. I ensure my fingers do not pass over the spinous processes. I press for 3 seconds on each point, then repeat the operation 3 times. Perform steps 18 and 19 on the right side. Scapular maneuver. A circular motion is performed outward, first counterclockwise with the left hand, then rotating clockwise with the right hand, 3 times on each side, first to the left, then to the right. Next, the maneuver is repeated simultaneously on both scapulae 5 times. After completing the treatment on the right side, I turn towards the recipient's head and position myself to their right, close to the scapulae, with my right leg forward. I extend my elbows and place my right palm on the right scapula and my left palm on the left scapula, ensuring that my palms make full contact with the recipient's body. I perform a circular motion outward, first counterclockwise with my left hand and then rotating clockwise with my right hand, doing this 3 times on each side. Then, I repeat the maneuver simultaneously on both scapulae 5 times. Occipital region, with the thumbs side by side. Medulla oblongata, with overlapping thumbs, left on top. Posterior cervical, pinching with the right thumb and the remaining fingers. Suprascapular point, with left thumb. Interscapular region, with overlapping thumbs, left on top. Suprascapular point, with right thumb. Interscapular region, with overlapping thumbs, right on top. Scapula maneuver with the palms of the hands. Here are some posture tips for those with neck pain. Keep your head in a neutral position, aligned with your spine, to distribute weight evenly and reduce tension on the neck. When working at a computer, ensure the screen is at eye level to avoid leaning forward. Your knees and hips should form 90-degree angles. Your shoulders should be relaxed, your sternum slightly tilted upward, and your forearms well supported on the desk. Consider using an ergonomic chair that properly supports your lower back and encourages good posture. Move regularly. Small intervals of movement or stretching every hour can prevent stiffness. Keep your feet grounded to stabilize your overall posture when sitting. Take care of the ergonomics of your workspace to ensure efficiency and prevent physical discomfort. When using tablets and smartphones, try to keep the device at eye level to avoid tilting your head forward, a habit that can stress the neck. You can use a stand or holder to keep the device at a comfortable height. When working with mobile devices, remember to take regular breaks. Every 20 minutes, look away from the device and focus on an object in the distance for about 20 seconds. This helps relax your eyes and improve your posture. Perform simple neck stretching exercises slowly, coordinated with your breathing. For example, you can perform rotations to the right and left. Keep your neck well aligned. Stretch your neck in this position and begin to inhale. Turn to the left while exhaling. And then return. Again, inhale and turn on the right. And back. You can perform forward flexion extension. Always keep your neck straight. Inhale. Bend while exhaling. Again, inhale. And back. You can also perform this exercise using the weight of your arms. Place your hands like this. And bend your neck. Using the weight of your arms to help, which do not push but hold the neck in position. Okay. You can perform lateral flexion extension in this way. Inhale. Always keep your neck well upright. While exhaling, bend your neck to the side. And then come back again and again, breath in. Keep your neck straight and then bend it to the other side to the right. This exercise can be performed with the help of the weight of your arm. Grip in this way and breath in. Breath out and stay there, using the weight of your arm. Without pushing, try to create some tension in the scalene muscles, the lateral neck muscles. Okay, return to the starting position. Inhale. While exhaling, move to the opposite side. Stay there for a little while. You can also take 2 or 3 more breaths in this position. Another exercise can be the double chin. In practice, you need to create a double chin by pushing your head backward toward the posterior position. Create the double chin this way. Breath in. While breathing out, create the double chin and stay in that position for a moment. And return. This is a very effective exercise. It is important not to tilt the head backward or forward, but to keep it in the same position, creating a 90-degree angle. It is very important to strengthen the neck muscles and improve posture. These exercises help you a little bit. Another exercise is keeping your head back while keeping your elbows bent at your sides. In this position, go back with your head. Breath in. Breath out. The exercise allows you to stretch the entire anterior fascia and improve shoulder position. Another exercise is to perform slow rotations with the shoulders. It can be done backward. It can be done forward. It can be done by alternating the shoulders backward and forward. With this set of exercises, you can maintain good neck condition. You can also prevent pain or tension. Another interesting exercise is to raise your shoulders as high as possible toward your ears and then let them drop. Raise your shoulders toward your ears and then let them drop. Again, up and drop. This relaxes the upper part of the back a lot. By incorporating all these exercises into your daily routine, you can reduce the risk of developing neck problems. This will help improve your overall well-being. You can suggest these exercises to your friends and family. We have reached the conclusion of this course, and I want to congratulate you on completing this study. It has been a true pleasure to teach you acupressure, and I sincerely hope that you enjoyed this course and that it provided you with the necessary tools to learn this technique. I encourage you to recommend it to anyone who might be interested. Acupressure is an art that is truly worth exploring, and I am sure that if you apply it, it will bring you immense satisfaction. I wish you continued exploration and practice of acupressure with passion and curiosity. A hug and warm regards from Fabio Ronchi.